All right, now we're doing a CPT. CPT RVA, page 251, exercise 31, and this is a level 1 exercise. Okay? So the problem reads like this.
Surgery, musculoskeletal.
Uh-huh.
This is surgery, and the section is the musculoskeletal.
All right, the musculoskeletal section of the CPT code, okay?
Patient presents to the hospital with an ulcer of the right foot.
Of the right foot, right?
Yes. Patient is taken to the operating room where a revision of the right metatarsal head is performed. Okay,
there's an ulcer in the right foot. That's a diagnosis. You ignore that because we are coding the procedure. So the patient is taken to the operating room where a revision of the right metatarsal head is performed. So that's what you're going to code, a revision of the right metatarsal head is performed. And you know that the metatarsum are the bones in the foot, right? Okay, so we're going to give you 3 seconds for you to pause the video and give us the CPT answer for this. 1, 2, 3. Okay, the answer is? The answer is, can you put in the answer after 1 that there's a modifier there, M1? Okay, the answer is a code 1 with a modifier, 28899-RT. The RT is for the right side of the body, right? So, did you get it? If you got it, then just go to the next video. If you didn't get it, let's give you a couple of tips. Okay, the first tip.
First tip, don't start with revision, but with the anatomical part.
The anatomical part.
Metatarsal head, or just metatarsal.
Right. Don't start with the word revision, although the procedure is revision, but you're not going to find revision in the index, okay? So this is just for a little experience. If you can't find the actual procedure, go to the anatomical part. In this case, the anatomical part is metatarsal head or just metatarsal. Metatarsal head is just a part of the metatarsal, so metatarsal will be fine, right? So you go to metatarsal and?
Number 2. The revision procedure of the foot is not listed.
Right. For metatarsal, they're going to send you to the foot, right? And then you're going to look for the revision in the foot, and you're not going to find it. So
it is an unlisted procedure.
So if you don't find it, there is one code that's for unlisted procedures, right? So you choose that one as an unlisted procedure. I don't find it, right? So, and tip number 3.
RT is modifier for right side.
The right side of the body, right? Because in the description of the problem it says right foot, right? The patient has an ulcer in the right foot, so that's the right side of the body, right? So the answer is 1 and a modifier 1, right? 28899 modifier RT. Okay, that is the answer. Can you get the answer with the tips now? I'm going to count to 3 so you can pause the video and get us the path, right? So 1, 2, 3. Okay, let's do the whole summary now. Okay, the problem is, it's a surgery problem, the musculoskeletal section, and the problem reads like this. The patient presents to the hospital with ulcer of the right foot. Right foot. That's why you need the RT, right foot. Patient is taken to the operating room where a revision of the right metatarsal head is performed, right? So the code number 1 through the index is found like this.
First you go to index. Then you go to metatarsal.
Metatarsal. Remember that we told you, don't start with revision. There's no revision. You got to go to metatarsal and?
See foot.
They send you to foot. And then?
You get to foot. Then you get to unlisted services and procedures.
Yeah, you start looking for revision and you don't find it. So this is a procedure that is not there. Revision is not there. So you just choose the one for unlisted services and procedures because it's not there, right? And the code is?
28899.
All right. Now we're going to check this with the tabular. So the code 1 through the tabular is?
First you go to tabular. Then you go to 28899. Unlisted procedure, foot or toes.
Okay. Now I'm going to point out that we're using the CPT code for what year? For the year 2011, and we're in 2015. So There might be a new code in the next issues of the CPT, but according to the 2011 book, the revision is not listed. So just be aware of that, okay? Because if you have the 2015 book, and there might be the procedure listed, then the code is different. But this is according to the 2011 book, okay? But what's important is how to find the code. Okay, now we need a modifier, right?
Right.
What's the modifier that we need?
Right. RT.
RT for?
Right side of the body.
Right side of the body. Okay, so the answer is one code with one modifier, or is 2889-RT. Okay? Thanks for watching, and please visit our website.